Hi, I'm Dr. Edward Kim. In this video, we'll talk about what to do after you've had eye surgery, including what to limit in your activity and what rare signs of trouble you should report to us right away. Because there's a lot of information here, you may want to watch this video more than once. To protect your eyes after surgery, you'll have either a patch or a clear cover on your eye, depending on your procedure. In some cases, we'll ask you to leave this patch on until the next morning, and in others, we'll ask you to take it off the same day. Check your instruction pages, which will tell you when to take your patch off. Once your patch comes off, throw away the cotton pad, but keep the rigid shield. Tape this shield over your eye before going to bed at night for the next 7 days. That way, you won't accidentally rub your eye and do harm while you're sleeping. Use normal medical tape to secure the shield in place. Some people prefer to wear ski goggles instead of taping on the shield. Either one is okay as long as there's nothing pushing on your eye and there is a solid barrier protecting your eye from being rubbed. The most important thing to remember is do not rub or put pressure on the eye. After most surgeries, you'll need to take eye drops and sometimes medicines by mouth to help your eye heal. We'll give you an instruction page and prescriptions telling you exactly what to take and when. Take time to learn the names of these drops and how you'll be taking them. These drops usually continue for about a month or longer, depending on the procedure. If you normally take eye drops for glaucoma, we would like you to continue them after surgery just as before, unless we tell you otherwise. If you take artificial tears or lubricating eye drops, these are also okay after surgery, but it's best to use a fresh, newly opened bottle for sterility reasons. For any combination of drops, try to wait 5 minutes between taking any 2 different eye drops to allow the first to absorb instead of being washed out by the second. And remember, keep your eye gently closed for a few minutes, which allows the medication to be absorbed. You may want to watch our separate video showing how to safely take eye drops. For the first 1 or 2 days after surgery, you may feel groggy, a little nauseated, dizzy, or have other symptoms of feeling unwell. These are common lingering side effects of the medication we use to relax you during surgery, and because of these symptoms, we recommend you not drive until at least the next morning after surgery and possibly longer depending on how you feel. Serious pain is fairly uncommon after eye surgery, but many people have a little discomfort or scratchy feeling like having an eyelash in your eye during the first 24 hours. Usually, Tylenol, Advil, or aspirin will be enough to take care of any discomfort you have, and you can feel free to take any pain reliever that normally works for you. Just in case you have more than that, we'll prescribe something stronger that you can take as needed. Don't hesitate to take the pain medicine you need. It will only help you heal, but if your pain is severe, you should call us at the phone number on your instruction pages. It's common for your vision to be very blurry for the first few days after surgery. It's perfectly normal to see floaters or black spots in your eyes. There may be a pink tinge in part of your vision and an overall change in the way your eye sees colors. These are normal symptoms, but if you notice your vision getting progressively more blurred or dark over time, please call us right away. It's okay to be left alone for the rest of the day after surgery as long as you can follow your instructions on your own. We recommend restful activity for the rest of the day, but it is okay to watch TV, read, or work on the computer. It's also okay to resume your normal diet. The next day you can resume most other activities, but there's just a few rules. It's okay to shower the next day, but it's best to turn your back against the shower spray. The next day, it's also okay to walk, use a computer, read, go to work, cook, and do light housework, as long as you're not lifting anything heavy or straining yourself. You can drive a car the morning after surgery if you feel well enough to do so safely. With the exception of some retina surgeries where gas is put into the eye, it is okay to fly in a plane and do most activities that feel comfortable after surgery. If you're in doubt, just err on the side of caution. Activities we ask you to avoid for the first week include any heavy lifting, like more than 30 pounds, or vigorous sports like tennis, golf, running, or biking, anything that may shake or jar your head. You should also avoid wearing eye makeup for 1 week after surgery, only because you don't want to apply pressure as you rub to take the makeup off. We also ask you to avoid swimming in a pool, the ocean, or going in a hot tub for approximately 2 weeks. It is not necessary or required to wear sunglasses after surgery any more than you normally do, but if you feel more comfortable with the sunglasses when you go outside, you can go ahead and do that. What's most important is that you don't rub your eye and try to keep it protected from injury while it's healing. With most surgeries, the eye will look fairly normal, but there may be a bright red spot on the eyeball, which usually takes about 2 to 4 weeks to gradually fade. This is especially common for people who take blood thinners or who bruise easily. Bruising of the eyelids or face, which looks like a black eye, is fairly common after eye surgery. That's because even the smallest amount of bleeding from the tiny vessels around the eye is quite noticeable. Be patient and this bruising will fade away over a few weeks. I hope this information is helpful and encourage you to ask our staff if you have any specific questions about your surgery. I'm Dr. Edward Kim. Thanks for watching.